Hello students, welcome to another lecture of pharmaceutical jurisprudence. In this lecture we will be starting with Schedule U, and Schedule U basically deals with the particulars which should be included in a manufacturing record. So the particulars which are to be included in a manufacturing records can be divided into two different sections. The first being the particulars which should be included for the manufacturing records of non-parenteral preparations, and the second being the particulars which are to be involved for the manufacture of parenteral preparations, right? So first we'll be studying the particulars which are to be included in a manufacturing record for non-parenteral preparations. So the first thing is there should be a serial number mentioned, name of the product should be mentioned, reference of the master formula record should be mentioned, then lot or batch size should be mentioned, and lot or batch number should be mentioned, date of commencement of the manufacturing procedure and date of completion of the manufacturing procedure should be mentioned, the name of all the ingredients should also be mentioned, then control number of the raw materials which are being used in the formulation should be mentioned, then date, time and duration of the mixing operation should be mentioned, details of the environmental controls, for example your room temperature, your humidity should be recorded on a daily basis and they should be mentioned, then date of granulation wherever it is applicable should be mentioned, then theoretical weight and the actual weight of the granules or the powder blend should be recorded and mentioned, then records of in-process control, right? During the procedure of manufacturing we record certain parameters, so the records of those in-process control should also be recorded. For example, uniformity of mixing, moisture content of the granule should be documented, then wherever applicable, wherever a liquid is being used, pH of the solution should be mentioned, weight variation should be mentioned, disintegration time, hardness, friability test results, leak test in case of strip packing, the record of filled volumes of liquid, quantity of tablets in the final container should be mentioned, and content of ointment in the filled container should also be mentioned. Then date of compression if you are dealing with tablets should be mentioned, and if you are dealing with the capsules then date of filling the capsule should be mentioned, date of sealing, coating, polishing, whichever is applicable in case of capsules or tablets it should be mentioned, then reference to the analytical record number stating the results of test and analysis. So whichever test and analysis are being done, those test and analysis, the results of those test and analysis basically are recorded in an analytical record. So the reference number of that analytical record should be mentioned. Separate record should be kept for the disposal of rejected material, for the disposal of rejected batch and the batches that have been withdrawn from the market. Then theoretical yield and the actual production yield of the product should be mentioned and it should properly recorded and mentioned. Then packing particulars indicating the size and quantity of finished packing should be mentioned. Then specimens of the label, specimens of the strips should be mentioned with proper batch coding information like the batch number, the date of manufacture, date of expiry, the retail price which is applicable, then signature date of a competent technical staff who is responsible for the manufacture process should also be done. Then there has to be a countersign of head of the testing unit or other approved person in charge of testing for having verified the batch records and for having released the batch for sales and distribution. Then date of release of the finished packing and quantity released for the sale and distribution should also be mentioned. Then the quantity which is transferred to the warehouse department for storage should also be mentioned. So these were the particulars for the manufacturing record if you are manufacturing non-parenteral preparations. Now coming to the particulars which are to be mentioned in the manufacturing record if you are manufacturing parenteral preparations. The points are almost same with some variations, like the serial number should be mentioned, name of the product, reference of the master formula record should be mentioned, batch size of lot size, batch number and lot number, date of commencement of manufacture and date of completion of manufacture should be mentioned, name of all the ingredients should be mentioned, then control number of all the raw materials which are being used in the formulation should be mentioned. Then date, time and duration of mixing are to be mentioned. Details of the environment control like your temperature and humidity should be recorded and mentioned in the record. pH of the solution should be mentioned wherever applicable if you are using liquid. Then sterility test results should be mentioned. Record of the check on volume that is being filled should be mentioned. Date of filling should be mentioned. Records of all the tests which are being employed during the manufacture process or after the manufacture should be mentioned. Then records of checking of instruments and apparatus which are used for sterilization should be mentioned. Then records of cleaning and sterilization of containers and closure should also be properly mentioned. Then records of sterilization should be mentioned because we are dealing with parenteral preparations. Then number and size of the containers which are filled and the quantity of containers which are being rejected should be clearly mentioned. Then the theoretical yield and the actual yield and the percentage yield should be calculated and mentioned. Then again there are some analytical records wherein the records of all the analysis is being documented. So the reference to the analytical record number should also be mentioned. Then specimens of labels should be there with proper batch coding information like the batch number or the date of manufacture, date of expiry, right? Then a signature with date of competent technical staff who is responsible for the procedure of manufacturing should be there. Then particulars regarding to the precautions which are to be taken or which the manufacturer has taken during the process of manufacturing to maintain the aseptic conditions are to be documented in the record. Then there has to be a countersignature of the head of the testing unit. Then a separate record of the disposal of all the rejected batches or all the batches that are being withdrawn from the market due to any condition should be maintained. Records of the reprocessing operations, if reprocessing has been done in any condition, should be maintained. So thank you so much dear students. This was all in today's lecture. Today we studied about Schedule U, and Schedule U basically deals with the documentation, proper documentation of entire procedure which is undertaken during the process of manufacturing of any drug product. And if you have any queries, any doubt, please feel free to reach out to me. And thank you so much once again for giving your time. Thank you.